Hi guys, in today's lecture we will discuss ABG, that is arterial blood gas analysis. This is a relatively tougher topic of medicine as compared to other units. However, if you just apply your common sense, you can solve maximum questions related to this topic with ease. So common sense of prevail, no nonsense. You should be straight smart in solving questions related to arterial blood gas analysis. So let's study. We will talk about ABG, arterial blood gas analysis. As the name itself indicates, blood has to be taken from an artery, preferably radial artery. Radial artery. You can take blood sample from other arteries as well, for example, femoral artery, dorsal pedis artery, but radial artery is preferred, but not before doing Allen's test. What is Allen's test? We will discuss this test in detail in subsequent slides. So for ABG sampling, blood has to be taken from an artery in a heparinized syringe while ensuring that there are no air bubbles inside. Why no air bubbles? This is of prime importance. No air bubbles. You guys must be knowing that atmospheric air contains approximately 21% of oxygen, while it contains only 0.03% of carbon dioxide. So if there is presence of air bubble inside the sample, it can falsely elevate the partial pressure of oxygen. It can falsely decrease the partial pressure of carbon dioxide. Okay? So there must be no air bubbles inside. In this particular diagram, you can appreciate that ABG sample is being taken from the radial arc at approximate angle of 45 degrees, and there must be no air bubbles inside. क्या देखोगे यूडीजी में, राइट? बहुत चीज़ें देखोगे, बट दीज फोर पैरामीटर्स मस्ट बी लुक्ड एट फर्स्ट. First of all, first and foremost, you have to look at pH. Second, you have to look at PaCO₂, that is partial pressure of carbon dioxide in arterial blood. You can also write it as TCO2. And third parameter, PaO₂, that is partial pressure of oxygen in arterial blood. You can also write it as PO2. Fourth parameter, beta-blase, right? Later on, we will also analyze ABG, right? We will look at other parameters as well. For example, serum electrolyte, anion depth, osmolality, albumin levels, etc. But as of now, these are four basic parameters which has to be looked at in ABG. Before proceeding ahead, let's talk about Allen's test. If you are taking blood sample from radial artery, then Allen's test is mandatory. Okay, because sometimes when you prick the radial artery, the artery might go into spasm. And if the ulnar arch is not patent, then this palm can go into ischemia or gangrene. Okay, so Allen's test has to be done if you are supposed to take ABG sample from radial artery. Let me explain this test. In Allen's test, you simultaneously block both radial and ulnar arteries. It will result into decreased blood supply of the palm and palm will turn pale. But you release the ulnar artery. On releasing ulnar artery, if ulnar artery is patent and if arches are working, then this ulnar part as well as radial part will again reperfuse. Okay, so this will again become reddish. Otherwise, it will stay pale. So it checks the patency of the ulnar artery and its tributaries, which will form collaterals towards the radial arch as well. Let me explain this. You will simultaneously block both radial and ulnar arteries. Okay, palm will turn pale due to less blood supply. You obliterate both the arteries, palm has become pale. And then you release the ulnar artery. Releasing ulnar artery, if it is patent, will result into perfusion of the ulnar part as well as radial aspects if collaterals are working. This is Allen's test positive. Okay, Allen's test positive. If Allen's test is positive, it means patency of ulnar artery is established and even there are adequate collaterals which will take blood to the radial side as well in case the radial artery gets compromised. Okay, I hope you guys got the point. This is real ABG. Though this is not normal, this is just a sample. Later on we will discuss this ABG in detail. Okay, for basic parameters, let's look at pH, PCO2, PO2 and bicarb levels. Later on, we are going to see serum electrolytes as well, anion gap, Okay, osmolality, albumin levels, glucose, hematocrit, etc. But as of now in an ABG, look at these four parameters. First and foremost, you have to look at pH. Everyone must be knowing what is normal pH. It is 7.35 to 7.45. What is the mean value? 7.40. Okay. PaCO₂, that is partial pressure of carbon dioxide in arterial blood. It is 35 to 45. यहाँ से hint ले सकते हो. Mean value is 40 millimeters of mercury. Partial pressure of oxygen 80 to 100. This is normal, right? No need to bother about partial pressure of oxygen as far as multiple choice questions are concerned. Then look at bicarb levels. Okay, this is 22 to 26. Average will come out to be 24. Okay, so these are four parameters which are very, very important. Later on, we will neglect PaO₂. Okay, these three in fact are more important. Okay, so in this ABG, pH is not normal, right? In this particular ABG, pH is only 7.25. So this is not normal. This is below 7.35. Therefore, it represents acidosis. Okay, and in this particular ABG, bicarb is lesser than 22. So basic problem which is responsible for this acidosis is metabolic problem, fall in bicarb. So this is primarily metabolic acidosis. Whether there is compensation or not, we will figure it out in upcoming slides. So in ABD, pH, PaCO₂, bicarb, these three things has to be looked at first. Okay, we will interpret in detail in subsequent slide. ABG analysis. pH, what is the normal range? 7.35 to 7.45. And what is the average value or mean value or a strict normal value? That is 7.0. Okay. PaCO₂, 35 to 45 millimeters of mercury. Average value, mean value or strict normal value is 40. So everything has to be remembered. Okay. This is very easy. Bicarb is 22 to 26. What is mean value? It is 24. So when we will interpret ABG as per Boston's criteria, we will need strict normal values. Boston's criteria. We will need strict normal values. Strict normal values, right? Or you can say mean. So mean pH is 7.40. PaCO₂ is 40. PaO₂ is 24. Bicarb is 24. Okay, I am neglecting PaO₂. So as per Boston's criteria, we will be taking mean values. This is mean pH. This is mean PaCO₂. This is mean bicarb level. Suppose while interpreting ABG, pH comes out to be 7.41. So this is more than 7.40. So anything greater than 7.40 will be taken as alkalosis. Okay, anything below less than 7.40, be it even 7.39, it will be taken as acidosis. It might be respiratory acidosis or metabolic acidosis. We will figure it out in later part of the lecture. Okay. So while analyzing, these mean values will become very, very important. Okay. But it is not about all these four parameters. There are other parameters as well. Let's expand our knowledge. Okay. We have talked about pH 7.35 to 7.45. Never forget this mean value. Basically, this is average, right? You guys will not forget at least. 35 to 45 millimeter of mercury is the partial pressure of carbon dioxide. Again, look at the mean value. Bicarb 22 to 26, mean value is 24. अभी एक एडिशन कर देते हैं. Just include anion gap also into this discussion. Okay, and normal anion gap is 12 or less than 12. 12 ले लेते हैं. तो बेसिकली एबीजी में हम लोग क्या देखेंगे? नंबर फर्स्ट, लुक एट पीएच. नंबर सेकंड, look at PaCO₂. Number third, look at bicarb levels. राइट, एक ऐड कर दे रहा हूँ. फोर्थ, look at anion gap so that you can memorize it easily. Too easy to understand. You guys already know that pH is 7.35 to 7.45. You will not, you dare not to forget the mean value. Okay, this is 7.40. What about PaCO₂? 35 to 45. Mean value will be 40. Bicarb 22 to 26. Mean value will come out to be 24. And anion gap has to be remembered as 12. Anything above 12 will be considered as high anion gap. We will discuss what is blood anion gap, what is urine anion gap, what is its normal level, how it is calculated. But as of now, try to remember values of all these four parameters. I have already vomited PaO₂, oxygen, okay, for the purpose of solving multiple choice questions, okay. Let's proceed ahead. Let's revise once again. Look at pH. मीन वैल्यू कितनी होगी 7.40. एज पर बॉस्टन्स क्राइटेरिया ऑफ एलईजी एनालिसिस, mean values will become very very important. Okay, PaCO₂ range, I know you guys know the range, just remember the mean value. It is 40 millimeter of mercury. Mean value of bicarb will come out to be 24. This data is very important for the analysis of ABG. Okay, in case of metabolic acidosis, anion gap also becomes an important factor. Okay, so anion gap will be exactly half of what? Bicarb levels. Okay, anion gap तब देखेंगे जब metabolic acidosis होगा, but यहाँ पे मैं इसको complete करने के लिए anion gap भी include कर दे रहा हूँ. Anything above 12, if anion gap is more than 12, it will be considered as high anion gap. Okay, high anion gap. I am not teaching anion gap as of now. We will discuss it in second part of ABG lecture. But just try to remember few things which will help you over a period of time. See, there are two organs which usually regulate acid-base balance in our body, right? And keep the pH in the range of 7.35 to 7.45. Those two organs are lungs and kidneys. यहाँ पे हम लोगों ने किसको ले लिया? लंग्स को. यहाँ पे हम लोगों ने ले लिया किडनी को. I will try to keep things very simple. Okay? अगर कार्बन डाइऑक्साइड से रिलेटेड कोई एसिडोसिस या अल्कलोसिस होता है, it has to be respiratory because lungs regulate the level of carbon dioxide, right, in proportion to partial pressure of CO2 in blood. So if someone is hypoventilating, I mean respiratory rate has decreased, carbon dioxide will start accumulating in blood, resulting into more of partial pressure of carbon dioxide. More carbon dioxide will react with waters and it will produce carbonic acid. Carbonic acid, as the name itself indicates, it is acid. So blood will become acidic. So anything related to CO2 has to be respiratory. And if CO2 increases, it will make blood pH acidic. If CO2 decreases, less of carbonic acid, pH will decrease and it will be respiratory alkalosis. So if carbon dioxide is related, it will relate to respiratory cause. Okay, so lungs are part of respiratory system. Anything related to bicarb is mostly related to kidneys, right? Because kidneys can reabsorb bicarb, and if they don't reabsorb that enough, they will lose bicarb. So balance of bicarb is basically responsibility of kidneys. Okay, so anything related to bicarb will be considered metabolic. Okay, so this is metabolic related to bicarb. Till now I suppose it is very very easy. Okay, in case someone is hypoventilating, respiratory rate has gone down, CO2 will start accumulating. Okay, if CO2 will start accumulating, partial pressure of carbon dioxide will increase. Okay, due to reduced respiratory rate. If carbon dioxide will accumulate, what will happen? See, carbon dioxide can react to water and it can form carbonic acid, H2CO3. This is carbonic acid. So whenever carbonic acid will increase, pH will decrease. I mean, it will result into acidosis. So if PaCO₂ will increase, PaCO₂ can increase only due to respiratory pause, right? Primarily. So this is your respiratory acidosis. कब ऐसा होगा? जब रेस्पिरेटरी रेट डिक्रीज होगा. Respiratory acidosis. I hope it is very simple. जानते भी होगे पहले से. If PaCO₂ will decrease, if respiratory rate increases, ventilation increases, there will be more of CO2 was out, less of CO2 retention. It will decrease the partial pressure of carbon dioxide in blood. Okay, in case respiratory rate is high. So less of carbon dioxide, less of carbonic acid, okay, less of acid will make the pH alkaline. Okay, so pH will rise and this will result into respiratory alkalosis. इससे भी तो कुछ हो नहीं सकता. And suppose kidneys are absorbing excess of bicarb either primarily or in response to respiratory acidosis. Whenever bicarb will increase, right, base will increase, and anything related to bicarb will be labeled as metabolic. So bicarb will increase, base will increase, pH will increase. So this will be labeled as metabolic alkalosis. Okay, if bicarb decreases, this will reduce the pH because alkali is being lost from the kidney. So this is metabolic acidosis. One more thing of common sense. If there is acidosis, compensation is rule, okay? Then it will get compensated by alkalosis. If there is respiratory acidosis, it will get compensated by metabolic alkalosis. If there is metabolic acidosis, it will get compensated by respiratory alkalosis and vice versa. This is very simple concept. I hope everyone got the concept right. Okay, CO2 will increase, AC will increase, pH will decrease, and it will result into respiratory cause, that is respiratory acidosis. If bicarb decreases, it is metabolic cause, that is metabolic acidosis. Okay, and vice versa. Kidneys कैसे रेगुलेट करते हैं pH, right? कई मैकेनिज्म है, एक डिस्कस करते हैं. This is proximal convoluted tubule, that is PCT. Usually 80% of filtrates gets reabsorbed in the PCT, right? Same applies to bicarb as well. So kidneys regulate bicarb level at the level of PCT. Okay, if there is respiratory acidosis, then kidneys will need to meet their pH normal. मतलब kidneys उसको किधर लेके जाएंगे, alkaline की तरफ. They will need to absorb more and more bicarb levels. So there will be compensation by kidney in case there is any respiratory defect. If there is any renal defect, it will be compensated by lungs by maintaining level of CO2, that is ACO2. Too simple to understand. In addition, DCT and collecting duct also excrete out hydrogen ions, right? So kidneys help in acid-base balance either by reabsorbing what? Bicarbonate, or by simultaneously excreting or absorbing hydrogen plus ions, right? So basically PCT reabsorbs bicarb, right, as per the pH of patient to normalize it, okay? Whereas respiratory system regulates the carbon dioxide levels. One more organ is very important in discussion of ABG analysis, rather acid-base disorders. Though it is not directly related, I will like to include this concept here itself. This is your stomach, right? Just make a demarcation. This is upper GI, this is lower GI. Okay? Upper GI, for example, take stomach, there will be HCl in gastric juice. Suppose there is upper GI problem, right? It can result into vomiting. Vomiting will result into loss of gastric juice, loss of gastric acid, loss of HCl. So it will result into loss of HCl. Loss of HCl will result into loss of acid, right? So acid will decrease, bicarb will increase. Bicarb को ज़्यादा acid buffer नहीं करना पड़ेगा, तो bicarb बचा रहेगा. So this will result into metabolic alkalosis. Metabolic alkalosis. Okay. So if there is upper GI problem, because upper GI fluids are rich in acid, so loss of this fluid will result into loss of acid and it will result into metabolic alkalosis. It will get compensated by respiratory acidosis. Okay, अभी compensation की बात नहीं कर रहे हैं. लोअर जीआई की बात करें, मान लो मैंने पैनक्रियाटिक जूस की बात कर लिया और इंटेस्टाइनल जूस की बात कर लिया. सो दीज आर बेसिक, राइट? दीज आर एल्कलाइन. And suppose this patient suffers from diarrhea due to any cause, maybe VI coma or anything or food poisoning. So patient will, if develops diarrhea, he or she will lose lot of bicarb, right? Because these fluids are rich in bicarb rich. In diarrhea, they can lose water electrolytes along with bicarb. So lower GI problems can result into loss of bicarb, therefore they can result into metabolic acidosis. Okay, and it will get compensated by respiratory alkalosis. So I'm also involved with gastrointestinal system also in acid based discussion, because we will get lot of clinical based scenarios in upcoming part of the lecture. Okay, so upper GI is related to acid, and if there is vomiting, acid will get lost, base will increase, right? So it will result into metabolic alkalosis. While lower GI, if fluids are alkaline, loss of lower GI fluids means loss of alkali, it will result into metabolic acidosis. Let's move further. हम लोगों ने डिस्कस किया normal range of pH. While we will be analyzing ABG, we will use strict normal values. Strict normal value क्या होगा इसका? 7.40. Okay, let's discuss the same thing of previous slide. So normal pH range is this. Anything below 7.35, even if you are not analyzing an ABG, will be considered acidic, right? This is common sense. Anything over 7.45 will be taken as alkaline. So if carbon dioxide will increase, I have already explained carbonic acid will increase, pH will go down, it will result into respiratory acidosis. Whereas if carbon dioxide level decreases, okay, is in decreasing trend, it means more of CO2 is getting washed out, less of carbon dioxide, less of carbonic acid, more of pH. It will result into respiratory alkalosis. Loss of acid, if it goes below 22, that is loss of bicarb, loss of base, loss of alkali, it will result into acidosis. So pH will decrease in acidosis, pH will decrease if carbon dioxide accumulates because it will result into production of acid. Loss of bicarb, again loss of alkali, again acid will increase, right? So this is acidosis, this is alkalosis. I have already explained you can have respiratory acidosis and alkalosis, you can have metabolic acidosis and alkalosis, and compensation will be exactly opposite. Okay, that has to be understood by common sense only. एक और निमोनिक ऐड करते हैं इससे पहले कि लेक्चर बोरिंग हो जाए, राइट? निमोनिक्स मेक आवर लाइफ वेरी वेरी इजी. So see why we are keen in maintaining the pH, because each and every enzyme works at optimum pH. Suppose there is acid base disorder and this pH gets deranged, body functions will cease. It can prove fatal because all enzymes work at optimum pH. It is not only about enzymes. When pH will increase or decrease, it will result into secondary electrolyte disturbances also. And this ABG also tells about electrolyte levels. We will discuss later on. So as a rule, whenever there will be alkalosis, either respiratory or metabolic, alkalosis will result into fall in potassium levels from serum. If potassium will decrease, it will result into hypokalemia. This hypokalemia can induce paralysis, cardiac arrhythmias and deaths. Okay, so you will deal with electrolyte levels as well in ABG analysis. See, this is very important, and this mnemonic will help you remember one electrolyte change at least in ABG disturbances. You write alkalosis. Normally you write alkalosis like this. I am trying to tell that in alkalosis, potassium levels will go down and it can result into life-threatening complications. How to remember this? Write alkalosis like this. Alkalosis. Okay, I have mentioned this thing. So this is potassium, and in alkalosis, potassium will become low. This is low, right? So if you are dealing with alkalosis, potassium levels will decrease and it can prove fatal. Okay, so even alkalosis will do lot of damage, and secondary electrolyte disturbances due to alkalosis can make things worse. Okay, so this can result into hypokalemia. Hypokalemia mechanism भी बता देते हैं, not only demonic. Okay, in case of alkalosis, there is intracellular shift of potassium. This is cell, this is potassium. So this is intracellular. intracellular shift of potassium. Cellular shift of potassium. Therefore, blood potassium decreases. Right? There is serum potassium decreases and it results into hypokalemia, which can result into what? Which can result into arrhythmias, paralysis and death. If not treated, arrhythmias, and it can prove fatal. So this mnemonic has to be memorized. Okay? Alkalosis, potassium will go down and it can lead to cardiac arrhythmias, paralysis of gut, etc. Right? Periodic paralysis, and it can also lead to death. Okay? So this is very, very basic thing. Once more, I will like to repeat the basic thing. If carbon dioxide will increase, carbonic acid will increase. Acid will increase, it will result into acidosis, and this is related to carbon dioxide, so it has to be respiratory. Compensation will be exactly opposite, and it will be by mainly kidneys. If PCO2 increases, acid increases. Then kidneys will try to conserve the bicarb. So bicarb retention will increase. So compensation by what? Metabolic alkalosis. Respiratory acidosis getting compensated by metabolic alkalosis. Okay, we are dealing only with common sense. If PCO2 decreases, carbonic acid decreases, acid decrease will result into alkalosis, right? So this is respiratory alkalosis. Compensation कैसे होगा? Exactly opposite. Kidneys will start excreting more of bicarb, so bicarb will decrease. So compensation will be by metabolic acidosis. Okay. If this is alkalosis, it has to be compensated by acidosis. If it is respiratory, compensation will be by metabolic. If there is fall in bicarb levels, it means alkali is getting lost. So less of alkali means more of acid. So compensation will be, this will be metabolic acidosis. Compensation will be respiratory alkalosis. So this patient will start hyperventilating, right? Patient will start losing lot of carbon dioxide. So acid decreases. So this results in compensation by respiratory alkalosis. If bicarb is more, it has to be metabolic alkalosis. It has to be compensated by respiratory acidosis by retaining more of carbon dioxide, and this particular thing is respiratory acidosis. Nothing is tough till now, okay? So I hope you guys are imbibing what I am trying to tell till now. When you will be interpreting ABG, okay, there is certain rule. Okay, one thing is you have to follow Boston's criteria. Okay, Boston's criteria. As per Boston's criteria, you will look at pH first, right? Anything below 7.40 will be considered acidic. Range nahi, right? Even 7.39 will be considered acidic. So first thing you have to determine whether the pH is acidic or basic, towards acidic side or towards basic side, okay? So here you have to take strict normal values. We will interpret ABGs. See, there are three things and this order has to be followed. For ABG interpretation, first you have to figure out whether it is acidosis or alkalosis. कैसे figure out करोगे? pH 7.4 से कम है. If pH is less than 7.4, even if it is in range, you will consider it as acidic, right? तो अगर मान लीजिए एग्जाम्पल मैंने ले लिया, pH है 7.36, this is less than 7.40, you will consider it as acidosis. Now your second job will be to figure out whether it is respiratory acidosis or metabolic acidosis. If it is respiratory acidosis, it will get compensated by metabolic alkalosis. So your third thing will be whether it is compensated fully, partially or uncompensated. Right? It can be mixed disorder also. Like in a case, if pH is low, it can be due to respiratory acidosis as well as metabolic acidosis also. So third step will be figure out whether there is any compensation or not. Right? Too simple to understand. Later on, if it is metabolic acidosis, you need to calculate the anion gap, right? And if there is low of albumin, you need to calculate the corrected anion gap. And then you have to look for the delta ratio also. All those things will be discussed later. So as a rule, First thing, determine whether it is acidosis or alkalosis. Okay. Second thing, what is the primary problem? Whether it is primarily respiratory acidosis or respiratory alkalosis or metabolic acidosis or metabolic alkalosis. Third thing is whether there is compensation or not. Compensation बिल्कुल reverse होगा. Whether it is fully compensated, partially compensated, uncompensated, for that we need to know about the magic numbers we will discuss later on. Compensation है कि नहीं? Sometimes it can be even mixed disorders like blood pH is acidic and it is due to respiratory as well as metabolic acidosis. No point of any compensation. Let's take an example. Okay, a question. A person undergoing surgery, it was necessary to aspirate the content of upper GI tract. See, in ABG, you always don't need to look at the clinical scenario, but at least you should understand. If there is aspiration of the upper GI contents, it means you are losing lot of acid. Okay, so pH will naturally go high. But even if you don't know the clinical scenario, you can interpret ABG by using Boston's criteria to much extent. Okay, so in this particular case, pH is 7.55. As per Boston's criteria, every mean has to be taken. Boston's criteria में क्या mean है? Boston's criteria, mean pH is 7.40, mean PaCO₂ is 40, mean bicarb level is 24. So any pH below 7.40 will be considered acidotic. Anything above 7.40 will be considered alkaline. Any PaCO₂ above 40 will be considered as part of respiratory acidosis. Any PaCO₂ level below 40 will be considered as part of respiratory alkalosis. Same applies for bicarb as well. If it is more than 24, it will relate to metabolic alkalosis. If it is less than 24, I'm not talking about range. If it is less than 24, you will consider it as metabolic acidosis. Let's analyze. This much knowledge is enough for this basic MCQ, okay? So pH is 7.55. As per Boston's criteria, it is greater than 7.40. As per the range also it is more. Okay. So this has to be first thing, alkalosis. I hope there is no confusion. Second thing is determine what is primary problem. If it is alkalosis, whether it is respiratory alkalosis or metabolic alkalosis. Okay. So second thing, look at the PaCO₂. PaCO₂ is not moving in the direction of alkalosis. If PaCO₂ is high, this will need more of carbonic acid and carbonic acid cannot take pH upwards. So this cannot be, right? So primarily this cannot be respiratory acidosis. Just have a look at bicarb levels. Bicarb levels have increased. It is 40. So second thing you have to see what is going along the side of pH, that is which can lead to alkalosis. This much of bicarb is more than 24. It is 40, right? So here you can interpret as metabolic alkalosis. I have already discussed this scenario. If there is loss of upper GI fluid, example gastric acid, be it in form of vomiting or nasogastric excretion, it will lead to loss of HCl, hydrochloric acid of gastric juice. Loss of HCl will result into alkalosis. But even if you don't know the concept, you can interpret this ABG. But it is better to know things in a clinical scenario as well. Now, third thing is whether there is compensation or not. Okay. Had there been compensation, this pH would have normalized. But it is not necessary that if it is fully compensated, pH will turn out to be normal, right? So, as per knowledge of current scenario, you can say this is uncompensated, okay? Because pH has not turned out to be normal, uncompensated. But exact compensation has to be calculated, right? For that calculation, we need magic numbers, right? We will discuss magic numbers later on. But as of now, this is case of metabolic alkalosis. Whether there is compensation or not, whether it is adequately compensated or partially compensated, we'll figure out in next part of lecture. Okay. Take an imaginary DD. Suppose a guy went out with his girlfriend and he had binged him, right? In the morning, he developed vomiting. right? Example of Dingsbury. Binge drinking followed by vomit. I am not talking about alcohol intoxication. Vomiting वगैरह किया, right? Dehydrate हो गया. pH became 7.46. PaCO₂ 40. Bicarb levels 20K. ओके, इसको इंटरप्रेट करते हैं. हाउ को इंटरप्रेट करते? फर्स्ट लुक एट pH. pH is more than 7.4 dB, so it has to be alkalosis. This PaCO₂ is normal, right? It has not moved either upward or downward, so it is normal. So this cannot cause pH to rise. Bicarb has risen, so this is metabolic alkalosis. CO2 has not moved, so it is not compensating, right? Third thing is uncompensated. We will calculate compensation in later parts, but as of now, I am keeping things very simple. Take one more example. Suppose someone's pH, irrespective of scenario, pH is 7.2, PaCO₂ is 50, bicarb is 22, right? क्या interpretation होगा? It is very simple case. First thing is whether it is acidosis or alkalosis. pH is less than 7.4, so this has to be acidosis. Now you have to look which is the primary problem. So which problem can lead to acidosis? Even this problem and this both has PaCO₂ increase will result into respiratory acidosis. Decrease in bicarb will result into metabolic acidosis. So sometimes you can find mixed problems. Okay, here you have respiratory acidosis as well as metabolic acidosis. So this is known as mixed disorder. This is very difficult to treat. No point of compensating each other. There are two problems simultaneously. Okay, you can say simultaneous metabolic acidosis and respiratory acidosis. क्लिनिकल सिनेरियो मिलेगा तो बता सकते हो प्राइमरी क्या था क्या नहीं था. ओके, एक और क्वेश्चन लेते हैं. सपोज someone's pH is 7.22, PaCO₂ is 50, bicarb level is 25. Now interpretation will change. First of all, this will result into acidosis, and this acidosis is due to high PaCO₂. So this has to be respiratory acidosis, and bicarb is trying to compensate it. It is more than 25. So you can label this case as partially compensated respiratory acidosis. I hope you guys got my point. I have lot of things to teach in next part of lecture, so I would like to stop at this point. Okay, just go through once again through this lecture, and we will take up the next part very soon.